So Tracy, I know you've got strong feelings about the frozen face look.
I have.
Tell me a little bit about how you feel.
Okay, again, I'm always at pains to say, you know, it's my opinion. It's not for all my opinion.
Yep.
It's just simply mine. I, again, always reference back to young people. I look at my 22-year-old daughter. She moves. She moves her face. She emotes.
She frowns at you, doesn't
she frowns sometimes.
Yeah.
And what I'm trying to do when I treat a patient is, of course, people don't want to have strong frown lines, and but that's why they come to me, to have them treated.
Yes.
I'm not going to undertreat them. But my view is that if we keep people looking in keeping with age,
Yes.
keeping them, don't make any odd looks or strange looks,
No.
and create a bespoke treatment. It is a toxin treatment, unless it's somebody very straightforward, normally it's quite bespoke.
Yes.
I will often leave whole sections, you know, I'll assess the brow. I don't draw all over unless I've got bits that I've got to really take care with. But I will often, I'll inject them and keep getting them to move and keep injecting, and I will often do it and leave whole sections of the brow sort of free. I'll extend, I extend very laterally and quite low, but I'll do it intradermally here. So I'll just put light touches just on the tail of the brow.
Intradermally, that's interesting.
I will when I get here.
Because less diffusion.
Less diffusion, the muscle just pick up a little bit, and it will. And so for me, it's about creating age-appropriate treatments, because age-inappropriate treatments do not beautify. They actually look strange. And I've seen young people look older than they are because it's clear they've had work done that looks exaggerated.
Yes.
And to me, that doesn't beautify them.
Talk me through the look, the exaggerated, that maybe the high eyebrows or...
Yes, and I appreciate and respect that some people want that look, and that's a given. But I think the hyper-elevated eyebrows, to me, they're a sign of something often being done.
Yes.
And I think in a more mature lady, actually make them look quite severe, slightly odd, and potentially older.
Yes.
In fact, I would even go as far as to say, in some of my more mature ladies, and they've been having, I will not recommend toxin anymore.
No.
I will be using other treatment modalities to soften lines, because often they are the ones with hyperactivity, you know, and they're the ones that will whiz up like this. And that's another reason why I will often not just do a glabella treatment. And in fact, most of my patients, if I audit, which we do, all our work and look at how many patients are just glabella patients and the other patients that are the full frontalis, probably 98% of my patients are the whole brow.
So there's the three areas.
Yeah, well, yes, so I do the whole, because I create, even if I just dust, you know, very light smattering across here, it will just give that lovely balance. I want everything to move very slightly, but all the right way.
Yeah.
So I will, for me, hyper-elevated eyebrows look potentially odd, both in the mature and the young.
Yes.
And I try and create, I know there's this phrase, these sexy phrases that come out like boy brow, and that we've got to be careful that we are just doing appropriate treatments.
I think absolutely, because it is you can tell inappropriately treated brow, can't you?
Yeah. And so for me, again, it's about not creating looks that are unnatural.
What about lower face toxin?
Lower face, I do a lot of jawline and neck toxin. I think that can be very good and prevent that you know, the pull down on the jawline.
So the
platysma, very nice, particularly people like me, that very lean, thin neck. And you, yes, that lean. So it's very, very good just to improve that jawline, as you know.
Because the muscle pulls down.
Yes, it does. So they depress all muscles, as we know, so it allows the elevators to take over. So if we're doing a treatment, even just a standalone treatment, we do sorry, let's try again.
Yeah.
So if I'm doing, I can just do a standalone toxin treatment in the neck and jawline just to help that elevation. Or sometimes we will combine a toxin with another technology treatment to enhance that result. So if we're doing a skin tightening or lifting treatment, we will often put a toxin in the neck and jawline to help that result look even better, which is great. DAO, you know, again, a little bit of that, but I mean, we've all seen the problems with DAO treatment. I've seen very many people, again, I hasten to say, not from our clinic, but with these very asymmetric smiles. And they come in and I say, have you had any kind of muscle relaxant or toxin in your, oh yes, I had some, and you get this sort of this asymmetric smile. So we have to know what we're doing there, don't we? It's an advance as far as I'm concerned.
We're very, very careful in any muscles around the mouth.
Absolutely.
So Tracy's top tips for toxin. Tracy's top toxin tips.
Tracy's top toxin tips. Keep age appropriate.
Age appropriate.
Bespoke it every time. So look at every person, which states the obvious, but it's amazing. You know, I still hear at conferences how many units should I use here and there. So bespoke it. Try and avoid odd age inappropriate looks. Keep it looking very, very natural. And always review your patients at 2 weeks.
Right.
I mean, everybody's policy is different. Every clinic's policy is, but I think that means you know what you've done, you're monitoring your work and auditing your work, and you can adjust, fine-tune anything then at that point.
Do you always see your patients at 2 weeks?
I do. I've never stopped.
No.
I've never stopped. I like doing that. I believe that is my service to them.
Yes.
So I believe that's part of my service.
Absolutely. And advanced techniques, lower face.
Advanced techniques, again, know your anatomy, be careful with it, and don't do anything you're uncomfortable doing. And I think, for me, I do a lot of platysmal bands, a lot of jawlines. I don't do much DAO.
No.
I rely on neuromodulation from HA fillers here.
Yeah. Well, that's a really good tip. So thank you very much for Tracy's top toxin.
Thank you.